This is Medical Coder RS, where every code tells a story.
Hi guys, welcome to the Medical Coder RS. So I have decided that I will explain in English and separately in a video, and I will explain in Telugu. That is in a separate video. I will upload daily 2 videos, one in English explanation and one for Telugu version explanation. Okay, so please, which language you have like you would interest to listen, you can go through that video. Okay, I will mention like in the title, that is the English version, Telugu version. Okay, fine guys. Yeah, please support. So regarding this, I have already uploaded a Telugu version, so this is English version. And before these videos I have uploaded in Telugu version, definitely I will upload an English version also in coming days. Please watch from this with Telugu version and English version. And before videos I will definitely upload in English version. Okay, yeah, here is the topic, chapter 3, disease of blood and blood forming organs and certain disorders involving the immune mechanism. So here the guidelines is reserved for future. So here don't have any guidelines for chapter 3 for now. Okay, and next chapter is chapter 4, endocrine, nutritional and metabolic diseases. So in that chapter, that is diabetes most important, and daily we are getting this quotes regarding this diabetes condition, and we have more guidelines to diabetes. So please concentrate while listening video. I will explain everything in detail, so please listen. Okay, coming to the diabetes, what is diabetes? The diabetes means where the blood glucose levels is high. Why will happen this diabetes means that due to insulin producing less or not producing by pancreas organ, in that having a beta cells, that beta cells will release the insulin hormone. So based on this, there are 5 types of diabetes codes like E08, E09, E10, E11, E13. Okay, we will let you know one by one in coming slides. That is next guideline, like type 1 diabetes. The type 1 diabetes occurred in children age also, because type 1 diabetes means the insulin will not produced by pancreas. So here that having as a juvenile diabetes also. The juvenile diabetes means type 1 diabetes. That is here saying guideline. Okay. This guideline is a new guideline in added by the 2025 October, like the pre-symptomatic type 1 diabetes mellitus. So here we have that code for E11.A category. So please concentrate while reading diabetes code for pre-symptomatic type 1 diabetes. Okay, and next guideline is type 2 diabetes mellitus in remission. This is also new guideline in 2025 October 1st. First of all, in remission means the condition is having, but the signs and symptoms is not there, like absent. That situation is called in remission. So for specific type 2 diabetes mellitus in remission, we have separate code like E11.A. Okay, so precautious while coding for diabetes mellitus in remission. And one more thing, that resolved term is not synonym for in remission. Okay, and next guideline is if the type of diabetes mellitus is not documented, so at that time we have to take by default E11 category type 2 diabetes. That is a guideline. The next guideline is diabetes mellitus and the use of insulin, oral hypoglycemic and injectable non-insulin drugs. So for diabetes mellitus, there are types of treatment like insulin or oral hypoglycemics or injectable non-insulin drugs. So Based on the document which code we have to take, I will let you know. Okay, if patient having both like oral hypoglycemic drugs and insulin, we have to code both regarding Z79.4 and Z79.84. Okay, and next, if patient having insulin and an injectable non-insulin anti-diabetic drugs, here this time also we have to code both Z79.4 and Z79.85. And next one, if patient having oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, here also we have to code both codes Z79.84, Z79.85. And one more guideline, like if patient having diabetes and treated by insulin for some time only for increasing the glucose level, at this time we should not code Z79.4 because that insulin given for temporarily, not permanent or a long term. So precautious while coding for temporary insulin treatment. Next one, diabetes mellitus in pregnancy and gestational diabetes. Regarding these guidelines, we will got information in the pregnancy related guidelines. Okay, and daily quiz, I will conduct one question at the last. If you listen clearly and concentrate here, the answer will find in this video only. So please comment your answer. Okay, by your answer only I will got confidence to explanation in coming videos also. Please support. Okay, the question is patient having diabetes mellitus, which code will you give? A, option A type 1 or B type 2. Yeah guys, thanks for watching. Please support. I will come with new videos in coming days, and don't forget to subscribe and like and comment. Bye bye.